we'll just get going here and see if some people trickle in. But thanks to everybody who is here for coming to this month's Educational Cafe. We're going to be discussing the community's COVID-19 response, and joining us are a couple of our community partners. And so I'll turn it over to Dennis Plummer, and he'll lead us off.
Welcome, everyone. I'm really glad you've joined us this afternoon, and I'm especially excited and pleased to have two of my friends, colleagues, and collaborators, Jenny Metzler from Albuquerque Healthcare for the Homeless, and Lisa Huval, Deputy Director for Family and Community Services. We've spent a greater part of our lives together over the last year, and that's what this Educational Cafe is about, is how the community here in Albuquerque really came together and responded in a remarkable way around COVID-19 and people experiencing homelessness. Back in March, if you'll recall, as we all began to hunker down and try to grasp what was happening in our world and how to remain safe, as I've mentioned in past educational cafes, imagine all of those stressors and then having the stress of not being able to be safely housed or not being able to quarantine, or if you had a place to stay, it's in a room with 70 other individuals. Because at the time when the pandemic hit, we had a full West Side Emergency Housing Center shelter, we had a full AOC shelter, and all of these people were very tightly congregated. And so that became an incredible challenge, not only how to keep people safe from the elements, winter or summer, how to keep them fed, how to keep linens going, simple things like that, but also just being on top of the medical care and behavioral health services that are so critical. And so we were faced with a lot of challenges. And what I'm going to do is I'm going to pass it on to Lisa here in a moment, just to kind of describe what the city was seeing and what the needs were. But remind folks that you're welcome to fill up the chat on Facebook or here on Zoom with your questions, and we'll get those at the end. And also just a quick plug before we go on, we're in the middle of our Father's Day Challenge. Mother's Day has passed. We're ready still for Father's Day. And you all have been amazing supporters. And so we're trying to raise $25,000 that we will have matched 2 ways, so that actually the end total will be $100,000. So go online and check how you can support that. And thank you for those who already have. So Lisa, setting the scene about all of that crashing down around in our world in March, and there you were on the inside with the city, seeing this massive emergency response. Can you talk a little bit about that?
Yeah, I mean, I think what we knew in March of last year was that if we were going to keep people without homes safe from COVID-19, we needed a coordinated and systematic response, one that included stakeholders from many different sectors. Luckily, we had started to convene some of those partners out at the West Side Emergency Housing Center because we had some medical folks offering a kind of rotating medical clinic out there. So we had partnerships to work from. And very quickly in March, we convened a group that we now call ourselves the Corona Crushers. We have a logo and a t-shirt. It's very official. Group that included Heading Home, Healthcare for the Homeless, UNM, the New Mexico Medical Reserve Corps, First Nations, and a few others that I worry I'm forgetting right in this moment. We started meeting every day. In mid-March, soon after the first case was announced in New Mexico, we convened this group that met every day, including weekends, for the first couple months, and still meet several times a week to this day to really build this coordinated and comprehensive response. Initially, we were very focused on the West Side Emergency Housing Center and how to keep folks safe out there. But over time, that really grew into the larger system of care for folks experiencing homelessness.
Yeah, that group was like, there were at least 30 different people on that consistently from the Department of Health, the hospital.
Exactly.
That was maybe one of the more remarkable collaborations I've been a part of, to see that it was not just a theoretical meeting, but 30 people on Zoom every day, 7 days a week, problem solving. How do we move 40 people in the next hour to isolate them because we have somebody who's symptomatic? Or how do we test 60, now how do we test 200 people? And so, yeah, that collaboration with the city, with the state, all the stakeholders was really, a privilege to be a part of. And I was incredibly proud of New Mexico and that team. Jenny, you really brought not only yourself but your team to the table in that collaboration. And so, do you want to speak some about you're one of the major healthcare providers here in Albuquerque, that aspect that you were bringing to those meetings and collaboration?
Yeah, I think, we just full on pivoted. So we're, as a federally qualified health center serving the population without homes, we are required, as is First Nations, our sister project in this with the Healthcare for the Homeless team as well. We're required to work with the Emergency Operations Center. We already had that relationship in what used to be emergency preparedness, now is broadened to all hazards preparedness. So we learned from our peers around the country, other healthcare for the homeless organizations in the Gulf area where there've been a lot of flooding, or where there were forest fires in Santa Barbara the year before, that this is something you need to be constantly vigilant and prepared for. So we were, and when we think about whatever the hazard, this was a pandemic, that you prepare for it, and the relationships are really important to be able to mobilize. So I felt fortunate that we can't emphasize enough, this partnership already in place to look at comprehensive health services at the West Side, and also across the homeless services system. We had a relationship with emergency operations. We were just able to sort of pivot and mobilize that. So we had been thinking about our role in that for a very long time. I think then, the pandemic, the blur of the past 14, 15, 16, however many months now, and everything that we accomplished. And now we're, not out of it yet, but we are moving into a post-event, post-pandemic mode. And I think that, ever vigilant, but learning from the lessons. We just knew we had been prepared for this. Our team kept saying, we're built for this. Some health centers and other places, the world was closing its doors. And so when you're experiencing homelessness, you might not have access to healthcare. You have a lot of health issues. You need to get your Suboxone or your methadone or your scripts, or you're sleeping rough and you can't wash your hands and isolate, like all the really practical things that we were all in much disbelief and fear dealing with COVID-19 was totally exposed and exacerbated even more for people isolated on the streets. So I think the forethought we have all put into it, and our models, that while the world was closing their doors, we were all full steam ahead.
Right.
And we had people work. We had our benches to rotate through when people began to get exposed, and with the isolation and quarantine. So it felt very sudden, but it's remarkable how prepared we were. And in New Mexico and in Albuquerque, the relationships we had in place to respond to a public health emergency.
Yeah, those relationships made it possible, not only in those meetings, but late night cell phone calls went on frequently. And so that it didn't feel like we were being caught off guard in any way, even though there are major surprises weekly, if not daily. It wasn't as though it was one agency trying to do something and wondering what the other agency was doing. It was really, we all knew, oh, Jenny, can your team do this? Or do we call Centro Savila or UNMH? Can they bring in this piece? And it was just this fluid conversation.
It was fluid. And Dennis, you and I have worked together for a long time, and you were much more comfortable with fluidity and natural path, and I'm very much preparation, structure, strategy. And so
well,
that definitely
talk about the systems piece of it, because that was what was remarkable.
Well, it was. And so as much as it was like, wow, we have all these people suited up and showing up. Now, what do we do with them? Do we just say, okay, this is all we have? And we had been looking at this beforehand, before the pandemic, like, what's the model to address healthcare needs and end people's homelessness, and how do we do that together? And then what are all of our roles in that model? Or do we look at whoever shows up and then try to piece together a model? And so we actually have come up with a really nice continuity framework that I think also was tested and accelerated through this. I want to say one really quick thing about this, like how comparatively well this worked, and the solidarity in the midst of the terror for so many people. It was a very scary time. Things were moving quickly and there were a lot of uncertainty, but then Congresswoman Holland was calling health centers in New Mexico, or at least in District 1, and checking in. And she called right off the floor at some point when they were trying to pass emergency legislation. And someone said, you know, the Congresswoman's on the phone, and I picked it up and she said, "Jenny, how are you doing?" And it was marvelous that she was checking in. And I said, "I'm great." It was like, and I thought that is the strangest thing to say, but I was just, even when we were like pushing it, no, we have to do it this way. No, we're missing that, or, you know, what's the niche, or where are we going to do harm, and where are we going to, you know, help? Even then, I think we were always so grateful for the energy and how everybody was bellied up on this.
Boy, you know, and I'm going to go back to Lisa to describe what it looked like, what this, you know, what the structure was. But to your point, Jenny, I was just thinking it's a number that staggered me when I saw it, partly because it came out of payroll. But we had over 10,000 overtime hours in a period of 2 months, because all of our staff went to the front lines and responded. And you're right, there was an energy of, this is our time, we're needed, this is a crisis, and this is what we do. So let's get in there and do it. And that was not just heading home. It was your shop, Healthcare for the Homeless. It was the city workers. It was that collaboration that we're talking about was commendable. And Lisa, I wanted to go back to you, because you know your view in the city, and you've been on both sides, right? You've been out in the nonprofit world before, and we've worked for many years, and now in the city, looking out, saying, this is happening. What are our options, and how do we keep people safe? You know, especially trying to space people apart. Just something very practical like that.
You know, I said this before, but, you know, initially we really did start with the West Side Emergency Housing Center, because it is our largest emergency shelter in the city. When it's at capacity, it can serve 450 people, although it usually just serves that number at the coldest time of year. So, you know, we started there thinking about how do we screen folks for symptoms. What do we do when we find folks who are symptomatic? How do we help get them tested and help them stay in a safe and isolated place until they recover or they get their test results back? One of the things that I'm most proud of, though, is I feel like it could have been easy just to stop there and said, you know, we made the WEC as good as it could be, the WEC being the West Side Emergency Housing Center. That's all we can do. But I'm really proud of how, as a city, as a community, you know, that we were able to pivot from like kind of starting there, but then pivoting and developing a larger system response. So, you know, part of that included decreasing the density at the West Side Emergency Housing Center so folks could be more spaced out. And in order to do that, we needed to stand up other shelters throughout the community that could accommodate people who needed it. Initially, we did this by actually standing up 3 of our community centers as emergency shelters. So they were still congregate, but they were smaller, folks were more spread out, and these were serving people that were older, had underlying health conditions that were at the most risk of dying from COVID-19 or severe complications. We did that for a couple months, and then that really evolved into a strategy of standing up several hotels that we call our wellness hotels to provide non-congregate emergency shelter, again, for individuals at risk, as well as families with children. We realized, just saw the demand, the need for safe emergency shelter for families with children. And although, of course, families, young kids aren't necessarily as vulnerable to the COVID complications as older folks or folks with medical conditions, they are also very vulnerable and have been very vulnerable during this pandemic. So we wanted to serve them as well. So that, you know, there's lots of pieces to that, but it was a whole really system of care of being able to help keep folks safe.
And at those sites, Jenny, I know that we learned a number of things, and your team was especially they were the ones who were probably the most remote working on site to all those community centers, as well as your street outreach and medical work there, but not only medical, but behavioral. Do you want to talk a little bit about the support besides just a cot that we were offering at the community centers, what was happening in the support service?
Sure, and I would say, so when we talk about healthcare here, it's clinical, broadly defined prevention. We have teams that much of the care that we provide increase in our roots, and now increasingly is not only at our 5-building campus at First and Mountain, which we had to close buildings down, so it was out in the field. And as those sheltering spaces, whether the wellness hotels or the isolation and quarantine hotels, de-intensified existing shelters, were kind of mapped out as the system of where people were. We were always cognizant that there were those who were not in those spaces, who for whatever reason would not come in. It was great working with UNM and Dr. Laura Patajon, who's now with the state and the Department of Health, and some of our teams really looking at why people wouldn't come in. And I think the system being aware of doing the barrier analyses and not just saying, oh, well, we need to leave them out there, but like, who can come in? How can we reduce barriers to people coming in, and then saturate them with the support that they need, whether, whatever kind of services. And so we rounded, whether it was teleservices or rounding on site, with our clinical teams and our harm reduction outreach teams and our behavioral health teams and some of our social services and housing specialists who continue to this day. And we were nimble, we shifted as the population shifted there and the needs changed. But we also at Albuquerque Healthcare for the Homeless, our niche was backpack medicine, really street medicine. We had a scouting team that would go out. We managed a street medicine dispatch, and then people could call in, or the scouts could call in, or some of our partners out on street outreach through the coordinated street outreach efforts. They also huddled regularly what's going on out there. They could call in, and then the emergency rooms could call in. Like there was a real time ability to connect people who were not sheltered to services or to testing. We could then mobilize a doctor or another medical provider, nurse practitioner, to get out in the streets and say, there's someone who seems like they might be sick. They're at Central and Tennessee. Can someone come out? And then they could mobilize in the afternoons. And that's one of the very exciting things, because those are people who would otherwise be left out. We did hundreds of isolation backpacks for people who could not get into isolation and quarantine space, or would not, for very good reasons, whatever they were. So they were camping, and we took them what they needed to isolate in place, some guidance from the CDC on how to do that. If you were sleeping rough, and really that was making sure that they didn't get left out of the system if the system was made up of 4 walls somewhere. And that's that's our mantra. And I think as a system we learned that together. It was very interesting with some of the medical providers who were volunteers through the Medical Reserve Corps and UNM and others who don't normally serve the population without homes. And over time, I can remember doing one of those walking meetings. We went around circles at our houses when we weren't on site, and listening to a call. And I heard some of them saying, these sort of rules we had about how things had to go. Like, we couldn't leave that person out there tonight, and they wanted to come in. So we extended our intake time, or we made sure that the outreach teams got out there and we got them transport and we got them in. And gives me chills. That's what we should be doing, is influencing with our models of care together those who want to serve this population and maybe haven't, and they came together in this. And when we heard that change, that sort of destigmatizing the systems that keep people out, or discriminate, and to see that begin to happen together was really exciting. It is exciting. It's still happening.
Well, and I want to follow up on that piece too. We've got about a couple more minutes here. And then again, folks that are listening, thank you for joining us. Continue to put your questions into the chat. We've got about 10 minutes total. And so we'll want to make sure we leave time for your questions. I just want to add 2 things. Practically, what was happening for testing. The MRC, the Medical Reserve Corps, would come out with their volunteer medical team and test hundreds at a time. Our staff would line them up, coordinate, go through, and that's no small feat to coordinate getting the test results back and still knowing where that person is who was tested, right? So learning how to do that effectively. We were also privileged, because of the partnership and collaboration, to be among the first who were vaccinated. We started receiving vaccines in December. Most of us finished in mid-January. And that included those people that we served. So not just the responders, which we all considered ourselves at that time, we all were the first responders on the front lines, but doing mass vaccination on site at the shelter. And the Department of Health was incredible in their mobility to go to different shelters as well and to offer that. So one of the things that you mentioned, Jenny, I was thinking about too, is that the things that we've learned from this, in addition to having impacted people whose experience changed their mindset, and that's how we change stigmatization. Also looking at that, and Lisa, this came out of your department, where there was a sense of, okay, we went from the community centers to wellness hotels, and COVID's kind of going away, or it's getting better. But we're onto something here. We're onto, like, these hotels could be flipped into housing. Families are no longer going back to the West Side. They're going to stay in one of these hotel shelters. So we're learning some new, or gaining some new backing and interest in these ideas of how we can look at housing differently.
I think that's true. You know, I think one place where we learned a lot at the city was just the incredible demand for family shelter. You know, because we can't account, up until COVID, we were accommodating families at the West Side Emergency Housing Center, but usually a fairly limited number. And you know, the location, it's 20 miles from downtown, the bus ride, just the logistics, if you have young kids, of getting into town and getting kids to school and work. I mean, very, very difficult for folks. So, you know, it wasn't surprising, but it was still just so eye-opening when we opened a non-congregate shelter, more centrally located, just the number of families that presented looking for safe shelter. And that has driven our decision to keep one, we'll be winding down 2 out of our 3 wellness motels, but we are planning to keep 1 wellness motel open until probably early next year. And that one is serving families, recognizing that there is such a need for family shelter, and that will give us time to kind of plan what our more long-term strategy is. And I think we all know, you know, shelters just isn't housing, but it provides people safety and dignity while they look for permanent housing.
Yeah, I think the barriers have been pushed against because of COVID in a healthy way. We had our limits pushed against, and I think we all reached some of our limits. I think in that collaboration, I think all of us rotated through a meltdown at some point in one of those meetings.
At least several.
Right. But, you know, you know, that group, again, is we bonded over crisis, and we bonded in a way that had direction and purpose. So we didn't always agree. We didn't always think we were doing the right response, but those strong opinions, having voice at the same table, I think, is an example of, not just for homelessness, but a number of issues for people to come together. And Jenny, you were talking about the system, and I know you introduced the infinity model as we charted processes and outcomes, and then loop back around to evaluate them. What do you see from your perspective as maybe a lasting impact, or something that we should not let go of and continue to follow up on?
Yeah, I think so. That started before the pandemic, and then it just, like, everything got so accelerated, these sort of conceptual long meetings we'd have about what's the system, what are we trying to do. And so, you know, I carried around in the front of my little binder here, it's always in front of me. I think we've got Carol Pierce, who's the director of the Department of Family Community. Also, you know, she'll hold it up in a meeting, and we're continuing to refine it. So I think that the pandemic allowed us to refine our roles in that. And so the way that model looks is it really captures, there can be an emergency response, there can be an episodic response to basic needs homelessness. And not everybody has to be going, you know, following through to the ultimate goals. Like, we all have our roles. And so there's sort of the immediate response, and there are people really, really skilled. You know, Dennis, you and your team, you were the logistical shelter providing, you knew how to do that. You know, the city had resources to allocate and people to bring together, and we had the healthcare piece of it. And so I think really emphasizing that when we get to where we can all respect and understand and define one another's niche in that, and when we can have cross-organizational, cross-institutional care teams that are person-centered, if we stick to that model. So I think there's that. I think I have to say that the New Mexico Department of Health and our governor and HSD, the people that were, pulled together, they were fortunate in New Mexico from a public health perspective, and New Mexico Department of Health, public health generally, like we know how to do that here. And we were really able to, and UNM, we were able to mitigate the spread of COVID-19 in the homeless population, and the numbers were not what they were across the country. So and I don't know that we have causal data that we could, but we know we did something right because we had really different outcomes. So I think we need to look at the impact, and we need to look at the players who are not traditionally homeless service providers who brought their resources and learned along with us, because that expands our capacity to end homelessness.
I'll do a quick answer to one of the questions in the chat, which ties into that. We don't know if it's causal or not, but we did have an outbreak at the West Side. Immediately, because of the response team, we were isolating individuals, helping them to quarantine, moving the most at risk to the medical, hotel, shelter, and continuing to do daily temperature taking. And after that one outbreak, we actually at one point, our infection rate was under 2% and the general population was over 10%. So it was actually safer to be in the shelter than it was all of those dangerous housed people that were spreading COVID. So that's how we handled that outbreak. Nick, I know you did get a question about families. You want to go ahead and ask any of the questions that you're seeing?
Yeah, there's a really good question in our Facebook chat from Helen, and she says, can you talk a little bit more about the unique needs of families with children experiencing homelessness and what might keep them from accessing congregate housing?
So either of you want to jump in? I've got I'll just start. Initially, one of the unique things that we have definitely seen is the access to a laptop for education, because COVID, all the education was remote. So they needed to have Wi-Fi access and a computer access. That doesn't happen when you're living in a car or on the street very easily. And so a very unique thing was making sure that the children had the support for appropriate to their age and a space in which they could concentrate and participate and respond, which was not the large congregate setting of a West Side shelter. So by moving to the hotel, they had private rooms. And so that uniqueness of a family, just to focus on the kids' education and their connectivity, is one unique piece of that.
And Jenny, I'll let you answer as well.
I know we just have a couple minutes left. So I would think, when you think about anyone who is experiencing homelessness, the violent victimization that can lead to it, the trauma, historical and current and repeating trauma is just really brutal. And so when you think about that and you think if you are a parent, single or partnered with your children with you, then taking care of them, just this whole conversation about the stimulus checks and unemployment, and is it disincentivizing people working? No, not paying people well is disincentivizing working, because the numbers don't work if you have to pay for childcare and you have to, access healthcare. So it's just sort of the complexity of trying to make the resources work that make it really difficult with families that are by definition more than one person. And so I think there are a lot of challenges there. I think trauma makes it particularly difficult, ongoing trauma.
Good point. Other questions, Nick?
Let me see here. Yes, we just got another one in our chat. It's do you think that these type of services can be mimicked and used in the long run when COVID hopefully becomes a thing of the past? It'd be nice to implement these services without there being a pandemic as the sole reason or sole cause.
Absolutely.
Yeah. I mean, we were doing all these services before, but what this did was we had no choice but to figure out how to work together, because it's always life or death. But it was like, and I think we all realized that for ourselves. We were, terrified for our families and our neighbors and people we care about. And so, yeah, I think it's the how we work together, and that's the bigger impact we can have.
One of the things that really struck me in especially in the early days of the pandemic, was that we were just able to move so quickly and with such urgency. And that was different, you know, like a lot of these stakeholders, we work together, we work together well, we're working towards solutions, but sometimes the pace just doesn't feel like it's matched to the need. And, you know, during COVID, that just changed. Like when there's a pandemic, like things just move a lot more quickly. And that's what I'm hoping that we continue to apply going forward, that sense of urgency, because homelessness is a crisis and people are suffering, but in some ways it's such a, you know, it's something we've become so used to in many ways that we've lost that sense of urgency. And that, you know, working in government, it was just really inspiring to see that government can move very quickly when needed.
Yeah, there were permissions given so quickly, and I don't know, forgiveness is asked later, and we're still sorting some of that out, like who owes who what, right? Because it was so much, because behind the scenes is all the infrastructure that has to process all of these things, our accounting systems, our administrative support systems. And so it was a bit like drinking from a fire hose, but we can do it, and we demonstrated we can do it, and there are mistakes along the way that we sort out. But to the questioners ask is that, you know, I think we definitely have learned there is, we don't have to let a crisis drive our system. Like the system can be strong and strengthened, and lessons learned taken forward even without a crisis. So
Dennis, I know you're going to try to wrap us up.
No, go ahead.
So I think going forward that there are some things we have to think about, and I can't emphasize enough, this is not over. And the post-event repercussions are going to go on for longer, and they're going to be harsher. Like, we think this was bad, and it's not to catastrophize, it's to keep our eyes open. And cash, resource, stimulus, money to people, the way emergency money flowed from the federal, state, city, county, made much of that like quick action possible. And I think something that because we were so in crisis mode, we did not reflect explicitly enough on the tremendous impact that exacerbated inequities, particularly racial equity. And I think going forward, if we can be a little more deliberate in holding together this system and being thoughtful about it, that we really need to look at the disproportionate impact and how devastating that is, and what we can do to address it and to close the gap on those inequities.
That's a great point. Our time has been really fast, really appreciated. I'm going to echo Jodine's comment in there, was that no question, just a great Zoom meet. And I want to thank Lisa for your generosity of time and all of your dedication over not just this past year, but quite a lifetime of dedication. And Jenny, I know that's true of you as well. Amazing past year, but amazing life that you've given dedicated to service. So it's an honor to be here with you both. Thank you. It's a privilege. Thank you to all of our watchers today. Thank you for joining us. And just a reminder, these educational cafes happen the third Thursday of each month, and we're open to ideas. We're kind of gearing up for our next cycle of cafe schedule. So we've done 6 to 8 of these. I forget how long we've been doing it now, but sure, check in on, send us an idea if you have questions and comments or thoughts about future educational cafes. So thank you all, and have a great evening.